Good morning, everyone. To those who haven't met me in person, I'm Greg Simon. As co-chair of our planning committee, I'd like to welcome everyone and like to begin by thanking our sponsor, the FDA's Office of the Commissioner, for supporting this event and for their long-term leadership on this important topic. This workshop will be the first of a three-part series by the National Academies Forum on Drug Discovery, Development, and Translation. The forum's mission is to focus on key problems and strategies in drug research and development, and it offers an ongoing neutral space where stakeholders from across government, academia, industry, foundations, consumer, patient, and family organizations can discuss and confront issues of mutual interest and concern. Through workshops and other activities, the forum brings together thought leaders to focus public attention on critical areas of drug research and development and fosters collaborative activity to understand and address these issues. Today's workshop will focus on how we can better align incentives and address barriers to support the collection and use of real-world evidence to enhance medical product development and evaluation. The aim is to call attention to the essential components of rigorous and meaningful real-world evidence, and from many perspectives, to promote generalizability and efficiency. In accordance with the National Academy's procedures, an independent planning committee organized the workshop. I think we have a slide showing planning committee members. Well, maybe that, there we go, let's see. There we go. Okay, thanks. This will be a standalone workshop and is not part of an ongoing study by the National Academies. There will be a brief overview summary of the presentations and discussions prepared by a rapporteur that will reflect what actually transpires here during the workshop, prepared in accordance with the institutional policies made broadly available to the public. All the views presented in the report will be those of workshop participants. It will not contain findings or official recommendations and will be broadly available. A few logistical points. We will have a morning break at about 11:10, a lunch break at noon, an afternoon break at about 3. This workshop is being webcast, and there's a Twitter hashtag, both a Drug Forum Twitter hashtag and Real World Evidence hashtag. We ask audience members, if you're asking questions or providing comments, to please use one of the microphones since we are being webcast. And for panelists, when you're up here in the discussion, please do turn off your microphone if you're not speaking. The slides will be posted on the forum's website within about a week of the workshop, and the link to the video webcast will also be posted. Speaker biographies and planning committee biographies are available on the table out in the lobby if you didn't see those. And now, to set the stage for today's meeting, we'll have a little music.
Sounds crazy, no?
Okay.
But here, in our little village of Anatevka, you might say every one of us is a fiddler.
You can take it down now. Thanks. A fiddler on the roof. Sounds crazy, no? But here, in our little evidence-generating village, you might say that every one of us is a fiddler on the roof, trying to scratch out a little commercially viable but still innovative product, keeping that balance without falling off or falling asleep. You might say, why do we stay up there if it takes forever and is so expensive? We stay up there because of one word, and that is tradition. Those of you who know the words can sing along. 1, 2, 3. Tradition, 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 tradition. Because of our traditions, we've kept compliant for many years. We have traditions for everything. We have traditions for how we write things down. We have traditions for how we correct our mistakes. We have traditions even for where and how we store our notebooks. For example, we always write in ink. We never erase. We cross things out with a single line and we put in our date and the initials. Following this tradition shows our devotion to God, good clinical practice. You may ask, how did this tradition get started? I'll tell you, except I don't know. All I can say is that it's a tradition. Rob?
Because of our traditions, everyone knows her and his role and exactly what's expected. day and night, FDA people must
Ooh.
scramble for a budget.
Say his Father Congress, say his daily prayers. So right as master regulator to have the final word over all. By now you all know the tune. It goes, FDA, FDA. You ready? FDA, FDA. Tradition. FDA, FDA. Tradition. Next, Joanne.
Patients and their doctors too, and FDA and payers too.
Ready? Industry, industry, tradition. Industry, industry, tradition. Dan.
I started preschool. By 33, I learned the trade. Still, Papa Health Plan picks my treatments. I hope they really work, or at least they're safe.
Ready? The doctors, tradition. The doctors, tradition. Sharon.
And who does help on us to pay and not complain and expect us to live or die, whatever health I fix? The patients.
The patients, tradition. The patients, tradition. Thanks to our performers. I had to do a little arm twisting to make that happen. Now, our silly reference to Fiddler on the Roof and Jewish religious traditions is not just because the High Holy Days begin tomorrow evening. It is more because if you watch the entire show, Fiddler on the Roof has a really relevant message about tradition, and it's actually a relatively subtle message. The message is that some of our traditions are vital anchors to our central purpose, and some of our traditions have become just anchors. They weigh things down, and they're really not connected to anything central or vital. And that is the charge of this meeting and this series of workshops, to try and discern the anchors from what is central and vital. And now to give us that charge, I'd like to introduce Dr. Scott Gottlieb, who is our Commissioner of the Food and Drug Administration. Dr. Gottlieb's career includes service in a wide variety of roles, all relevant to our mission today, including work in care delivery, in healthcare operations, in public service, in industry, and as an advocate for people living with cancer. Since rejoining the FDA, he has been a vigorous advocate for this concept of how do we make medical research faster, better, and cheaper. Dr. Gottlieb.